Hello, everyone. I'm Shelby Monier. I'm the Vice President of Patient Programs and Education here at Zero. I'd like to welcome everyone and thank you for joining us for a very special Facebook Live event. As some of you know, prostate cancer might actually be written in certain men's genes, but the exciting news that we're going to share with you today is that those instructions for discovering new treatments and understanding family risk of the disease may actually be written there as well. So joining me today are Dr. Heather Cheng and Dr. Channing Paller, lead investigators of the PROMISE study. Dr. Paller is Associate Professor of Oncology and Urology at Johns Hopkins University, Sidney Kimmel Comprehensive Cancer Center, and Associate Director for Oncology of the Johns Hopkins Clinical Research Network. Dr. Cheng is Associate Professor of Medical Oncology at the University of Washington School of Medicine, Director of the Prostate Cancer Genetics Clinic at Seattle Cancer Care Alliance, and faculty member at Fred Hutchinson Cancer Research Center. The PROMISE study aims to help us understand how prostate cancer care can be tailored precisely based on a patient's unique genetic profile. This means better information, better testing, and better and more choices for prostate cancer patients. So welcome, Dr. Paller and Dr. Cheng. We're so thrilled you're here. I want to first start with you, Dr. Paller. Would you please start out by telling us just a little bit more about the PROMISE study?
Thank you, Shelby. We're delighted to be here. PROMISE is one of the most exciting studies that we're working on, and we've known for some time that our genes matter. We've known this from breast cancer. They matter not only for a risk of developing cancer, but also for the importance knowledge of learning about developing personalized treatments for patients. And so the PROMISE study gives us this opportunity to study this in prostate cancer. It gives us this opportunity to learn not only more about the risks that our genes play in our risk of developing prostate cancer and other tumors, but also in improving treatment options and outcomes for men with prostate cancer. So specifically, we hope to do three things. First, we really want to understand how our genes influence our susceptibility to developing prostate cancer. And I would say to all of the wives and mothers and sisters and daughters out there that this is also going to test for other hereditary genes associated with other cancers. And I think this is important for the whole family. And secondly, we're going to look at how our genes impact treatment effectiveness. And third, we're going to look at how our genes could potentially lead to new discoveries and new treatments. So it's really these three things that we're hoping to do with PROMISE.
And then maybe I'll just add to what Dr. Paller was saying. I think this is really a unique project because it's a strong collaboration between investigators like ourselves, but also partnering with patients, their families and their physicians, as well as researchers in the community. So one of the really nice things about this project is that it's supported by a nonprofit. So it's not driven by kind of pharmaceutical interests or commercial interests. There's no cost to the patient to participate. And you can, if you're a patient, you can remain under the care of your own medical team. So we're not sort of disrupting any sort of ongoing activities or therapeutic relationships. We're just trying to sort of leverage additional sort of knowledge and support. And it's really simple, and you can do it, especially in the era of COVID, you can do it from home, you can do it on your own schedule. And so I think it's really a nice opportunity for patients.
Yeah, that's such great points. I mean, those are so important now, but especially now, but always too, just making advanced treatment options and availability of clinical trials available to more people and meeting them where they are. So that's wonderful. Thanks so much for sharing. So to help us better understand prostate cancer, we have to better understand our genes. This is why this genetic information of prostate cancer patients is so important to help us then fight the disease. So Dr. Cheng, would you mind sharing just a little bit more about these genetic factors and how they impact prostate cancer?
Yeah, I think one of the really exciting things in medical oncology and in our field, Dr. Paller's and myself, is that we're moving from an era where the treatment of prostate cancer is a little bit more sort of one size fits all, and we're getting much more knowledge and treatment advances, diagnostic advances to be able to tailor treatment so that it no longer is one size fits all, but more tailored for patients. And so this is going to help us understand what works well for treatments for certain genetic features of cancer and which ones don't. So that can help us kind of just be more thoughtful about our treatments for patients. And so an example, I guess I would like to share with everyone is a patient that I met in a second opinion. So we often see folks who come when their local doctors have tried all the available best treatments and they're looking for opportunities, for example, on clinical trials. And he came to me in a wheelchair. And really, I think his doctor had said, well, you can go on hospice or maybe just go to Seattle and see if they have any more thoughts and ideas. And we noticed that he had an extremely strong family history of breast cancer. But the notes all said, well, there's no family history of prostate cancer. We know that prostate cancer is very heritable. So that's an important question to ask, but it doesn't stop there. We really want to know, are there other family members with cancer? And so it turns out because of this observation that he had a really strong family history of breast cancer, he got tested. This was before PROMIS, but similar testing to PROMIS, right? And he was identified to have a inherited BRCA2 mutation that was a new finding for his family. So no one else in his family, or they were only beginning to sort of recognize the importance of this in the breast cancer world. So that the sort of implications reached beyond him, but also to all of his other relatives, men and women. And then because of that, we were able to treat him with targeted therapy, and he was able to get from the wheelchair back onto the golf course and spend, more valuable, meaningful time with his family. But then it also provided really important information for his family members. So this is a sort of example. It's, not going to be necessarily the case for everyone that they'll have that dramatic of a response, but we don't want to miss out on people who could have that. So I think that's one of the really exciting, and then, there are going to be other treatments for other genetic features and so, other genetic mutations. So I think that's what makes me most excited about this.
That's a great story, Heather. And I want to share a patient who was excited I was doing this. I saw him on Monday, and he reminds us of the importance of clinical trials and research. So he came to me about 3 years ago, devastated that his prostate cancer had recurred after surgery and radiation with hormones. And he just was beside himself. And together we looked at his genes and found that he had a genetic mutation that matched one of my clinical trials for targeted therapy. And so he's actually been on that therapy now for 2.5 years with no evidence of disease on his scans. And he's just thrilled. And he wanted me to share with you that he's not been on hormone therapy. He's flying and traveling and working and exercising and taking care of his family. And so it's really other stories like this that we want to match people to new therapies and new options. And I think that's part of what we hope to do is match people to clinical trials.
Yeah, thank you. Those stories are just, they give me goosebumps. They give me the chills. They're so incredible. So thank you so much for sharing those. So I have to imagine a lot of our listeners and viewers are wondering if the PROMIS study might be right for themselves or for a family member or a loved one that has been diagnosed with prostate cancer. So talk to us, Dr. Paller, about who's eligible to participate in the PROMIS study.
Yeah, the PROMIS study is intended for all men age 18 years of age of older and older with prostate cancer. And so I wish we could sequence everybody for free, but this is really for prostate cancer patients with evidence of prostate cancer, either by PSA or by biopsy, PSA over 100 or by biopsy and or imaging that shows that they have prostate cancer. And with their doctor, they know this. And so we invite men from all stages, whether it's localized or metastatic, meaning it's spread to stage 4 outside the prostate. We invite all men to participate. And we're going to look for men with specific inherited genetic factors that we'll be able to enroll in our long-term study, about 15 to 20 years, to follow them over the long term.
Wow, that's great. So, Dr. Cheng, why would we talked about the benefits that you shared very clearly in the patient stories that you just shared? So we know, we know some of the benefits, but talk a little bit more about what are some of the other reasons that someone should consider joining the PROMISE study?
Yeah, I think in addition to kind of the really remarkable sort of stories that we just shared, I think the other part that is important is, as a field in oncology, that we move forward and do more kind of interrogation or sort of deep learning about genetics. We will need to learn about all of the different types of genetic mutations, and some we know a lot more about. For example, BRCA2, the example I gave of the first patient, Mr. M, that's a gene that we have a lot more data about. So, but there are a lot of other genes that are implicated. We know they're overrepresented in really advanced prostate cancer. And so it suggests that those genes may be contributing to certain behaviors of the cancer. And we might learn more about that and be able to tailor treatment. So it's good to know, or it's important to understand when it works well, when treatments work well and when they don't work well. So we also want to learn from trials of treatments that don't work. And so I think putting all that information together will just help us all as a field learn more. The genes that we know less about, we fill in the gaps, and the treatments that are to come, knowing which ones work better and which don't. And then really it helps us understand, kind of as we've sort of alluded to already, for some genes, we'll know more about the family risk. And that can empower relatives, if they choose to know, options for life-saving kind of risk reduction procedures or screening for other cancers, things that we already have available that are immediately, things that could make a difference today. So, it's simple, it's free, it's medical grade testing. It's not recreational testing. Some people, are really interested in other types of testing that are more recreational. This is medical testing that can be used for medical management. And so another sort of a concrete example of how this might make a difference for a patient is a patient that I know and work together with, James, who participated or was found to have a BRCA2 mutation. At the moment, he's doing well, so he doesn't need a change in therapy, but this information is important for him for future kind of clinical trial considerations. But what also impacted him is that his daughters were tested, and one of his daughters has a mutation, and she was able to then enroll in a specialized BRCA screening program. And so she has options. And actually, Steve, the patient I mentioned earlier, his daughter also was able to do prophylactic or preventative surgery to reduce her risk of cancer. So there are these opportunities that extend beyond our patients that can benefit the relatives, in addition to the excitement of new targeted therapies and clinical trial options.
Right. I mean, opening the door to having those conversations, like you mentioned, is so important. And it can be difficult to have those conversations about one's family history and family health history. But as you mentioned, so incredibly important to, this is a family disease. We call it that a lot because it affects so many people. So thanks, Dr. Cheng. Dr. Powler, we hear a lot at Zero about some hesitancy to participate in trials. It's I can't do it. It's going to cost too much. Or I have to travel, and we've talked about that a little bit. But talk a little bit more about what the commitment to participation is like. What does one have to commit to participate?
Sure. So PROMISE is really, we designed it to be simple, easy, free for patients. We designed it for them to do it from the comfort of their own home and to keep their own physicians at no cost. So the first thing that you do is you sign up and you receive a DNA saliva test kit at home. This test kit tests for 30 genes associated with hereditary cancers, and then you meet with a genetic counselor to go over those results. Then for patients who are found to have a particular set or subset of genetic mutations that are associated with prostate cancer, we plan to follow those patients for the long run. So for at least 15 or 20 years over time. And we ask their permission to have their physician's office provide us with medical records every 6 months And around the same time, we'll ask them to fill an online survey of how they're doing, how they're feeling, what their treatments are, sort of any news they want to share with us as well. And so, of course, patients can choose to leave at any time, but we hope we can really learn from each other, right? So at its core, Promise is a network. The more people that sign up, the more we can learn, the more people we can help. And so we really hope that people will sign up.
Yeah, absolutely. So important for that increased participation. Love hearing how easy you and the designers of the trial have made it for patients to participate. So all of that seems so easy, such great news, especially not having to change doctors, not having to incur costs, traveling to a different cancer center. I mean, we know that patients often have a great bond with their treatment team. So all of that is such good news. Dr. Cheng, can you tell us a little bit more about how a patient could join Promise? So what are the first steps that someone who's interested might take?
Yeah, it's a great question. Thank you. So it's pretty easy. I think if you are interested, you want to learn more about it, we have a really lovely website called www.promise for prostate cancer, prostatecancerpromise.org. And you can go there, learn more about the study, and then register. You can sign the consent, just read more about it. And then we do encourage everybody to talk to their physicians, because it is important information that can also be used for we want it to be used as part of the care. And so I think that's something we really strongly encourage. And the other thing I'll mention that comes up is sometimes people ask, oh, if we've already had testing and we know we have a mutation, can we participate? And the answer is absolutely yes, because again, as sort of to echo what Dr. Paller was saying, we really want to sort of learn more over time and give that information back. And that really is a two-way, we want to share what we're learning so that patients and families stay up to date about the new development and new treatments and kind of exciting opportunities from that standpoint as well. So then a saliva test our tube is sent to, mailed to the participant's home, spit into the kit, and then mail it back. So pretty straightforward. And we have a helpline too. So if people have any technical difficulties, they can always call us.
That's great. So I will say, leads me to a question that I want to dig into a little bit more is, we hear a lot at Zero, there's some hesitancy when we use the term genetic testing, and especially I think among people of color. So are there some protocols in place to put people's minds at ease when they're thinking about participating? Some of that hesitancy like we said, can we put that to ease a little bit? And can you share a little bit more about some of those privacy concerns that folks might have?
Absolutely. So security is so important. And I want to assure everybody that measures are in place to ensure the safety, security, and privacy of their records. That records will never, ever be sold. And the records are only going to be shared with Promise researchers and only used for cancer-related research. So please know that we are taking many protocols and many measures to ensure the safety of people's information.
Yeah, that's great. I love to hear that. I know that has to put a lot of minds at ease. So after tuning in and hearing about this Promise study, I know that a lot of patients are likely going to want to learn a lot more about it. The website that Dr. Cheng, you mentioned, the prostatecancerpromise.org. Our team will make sure that that's in the Facebook live chat. So thanks for mentioning that. And be sure to speak with your doctor, to all those who are listening, to learn more about this valuable study. Like the doctors mentioned, the more people who participate, the more we're going to learn. So it's really, really important. So with that, I'd like to, I do have maybe a couple questions if we have a few moments, if that's okay with you both. So you mentioned you don't have to live near University of Washington and Johns Hopkins. That's correct, right? You can really participate because it's all done by mail.
Yes,
Just to
any,
confirm.
any man who otherwise meets the criteria that Dr. Paller mentioned over the age of 18 and has a diagnosis of prostate cancer can participate from anywhere in the country.
And really, regardless of where they are in their treatment journey.
Correct. Yeah.
And we talked a little bit about kind of the funders behind the study. So is anyone making money on this type of, on a research like this? So talk a little bit more if you can about who's behind PROMISE.
Yeah, so PROMISE is a unique collaboration among physicians, researchers, and patients. And the research is supported by a group of mission-driven nonprofit organizations, and no pharmaceutical companies or commercial interests are involved. And we felt strongly about that because we really wanted patients to feel like their data was protected, and this is to help them, their families, and future prostate cancer patients.
Got it. Thank you. Well, I think this sounds so exciting. I cannot wait to hear more about results in the future. So with that, I'd like to close our Facebook Live event. I hope that everyone enjoyed this informative session. A huge thank you to Dr. Cheng, Dr. Paller, for being here with us and sharing your exciting study.
Thank you so much for having us and everyone in the audience.
All right. Thanks, everyone. And we'll post that link in the chat. I'm sure it's there already, and appreciate your time with us today. Be well.